Hello, I'm Matthew Weinstock with Hospitals and Health Networks. In September, Rick Pollack will take over as President and CEO of the American Hospital Association, replacing Rich Umdenstock, who's retiring at the end of the year. Rick has been with the association for 32 years, and since 1991 has led public policy and advocacy efforts for the association. He joins me now to talk about that leadership transition. Rick, thanks for being with me.
Thanks for having me, Matt.
So as I said, for about 25 years now, you've been leading advocacy and public policy for the association. But I also know that one of the things you think is that advocacy is beyond what happens on Capitol Hill. Talk about that broader view for me.
Well, you know, the broader view for the American Hospital Association is, in my view, is we want to be the most influential association in America. And influence is derived from advocacy, but advocacy takes place not just in terms of lobbying on Capitol Hill. It takes place in multiple arenas. It takes place in multiple locations. And advocacy isn't just about advocating in the sense of representing the members' interests. It's also advocating for change in the healthcare system. When we talk about advocacy, to me, anything that we do to improve the public trust and confidence of hospitals is advocacy. So improving hospital performance is a part of advocacy. Addressing disparities and addressing diversity is a part of advocacy. So I look at advocacy in the context of influence, and again, I look at it in a much broader way.
So let's talk about one of those topics that really crosses all those things, which is the Affordable Care Act. In June, the Supreme Court upheld the subsidies that are offered to people on the federal exchanges, creating some stability. But we also know there are going to be continued legal challenges, legislative challenges to that law. How does the field manage during that sort of challenging period?
Well, a couple of observations. First, boy, are we relieved that the court ruled the way they did to take the uncertainty of coverage expansions through the exchanges off the table, and that we know that people, 6.5 million people, will get those subsidies through the federal exchanges. So that was certainly a relief. And you're right, there will be efforts to continue to repeal the law, but those aren't going to go anywhere as long as the president is in the White House. And I think it's more than a theoretical discussion now where there are a lot of people that benefit from the law. I think what we're more likely to see are challenges around the incremental unraveling of it. The challenges that really remain are at the state level in terms of trying to expand Medicaid in those states that haven't yet expanded. And I know the state hospital associations have been providing great leadership in that regard. The other piece, now that we've gotten past King Burwell, that is really an opportunity, are efforts to refine and improve the law where it needs to be improved. For instance, having a socioeconomic adjustment to the readmissions penalty, overhauling the hack penalty program so that it makes more sense, so that people could be rewarded for when they improve, not just penalized. Trying to delay further the Medicaid and Medicare dish cuts because coverage hasn't expanded the way we would have hoped. We've been able to put off the Medicaid dish cuts until 2018, but we need to do more in that regard. Those are all bipartisan efforts, and those are really opportunities in moving forward.
I want to switch gears a little bit to talk about this idea of consumerism and transparency in the healthcare system. Obviously, transparency is something that has been in the forefront of hospitals for the past, and the consumer for the past few years. Talk a little bit about how you think the AHA and hospitals can help consumers really understand what they're paying for, especially as we move into more high deductible plans and patients have more skin in the game.
Absolutely. It's a big issue. And, you know, we've adopted principles on how hospitals should present the information to the public. And one of the things that we've said is that it needs to be easily understandable. And we know that hospital bills are something that are quite complicated, but we need to do better on that. We need to make sure that people understand why prices vary and what the differences are between a price and a rate. You know, Medicare gives us a rate. We don't set a price. Medicaid gives us a rate. We don't set a price. With insurers, we may have a price, but there's a negotiated rate. We need to make sure consumers understand that. We need to make sure that when we provide information to consumers that they understand that they may be getting bills from other caregivers. We need to make sure that when we provide information to consumers that we're also informing them of the various plans that we have to help people that are of limited financial means. We have worked to provide best practices to the field. We've worked to provide tools and guides as to how one could present information in a way that is digestible for the public. Because what most consumers care about is what is their out-of-pocket exposure. And the health plans are really in the best position to do that. The other thing we think is the important pathway in transparency is really working through the states. Over 40 states already have mandatory transparency requirements or voluntary programs. Some of the state hospital associations have been pioneers in putting out price point programs. We support federal legislation that says the states need to have these types of programs in place.
And as we move towards bundled payments and accountable care, does that become more important?
I think that it becomes more important, and one of the things that is also important for us is to make sure that the patient understands that it's not all about price. It's about value, and when they make these decisions, it's about quality, and there are a lot of places that they could go to for recommendations relative to performance on quality, and they always got to consult with their physician when making these decisions.
Great. And Rick, lastly, on a personal level, what are some of the leadership lessons you've learned over your career that you're going to bring with you to this new post?
Well, there are several. One is that leadership is all about teamwork, and people are invested in things that they help create. And that's something that's very important to me in terms of a leadership quality. I also find that good leaders are great communicators. Good leaders are very good at simplifying things, trying to point people in a direction in terms of where things need to be addressed and trying to show how to get there. I think good leaders are very good listeners. I've also found that good leadership also involves never being afraid to surround yourself with people that are smarter than you. I've always done that, and I'm going to continue to do that.
Well, great, Rick. I appreciate your time and good luck in the new role.
Thank you. Look forward to working with you.
And I'm Matthew Weinstock. For more of my interview with Rick Pollack, be sure to check out the August issue of H&HN. Thanks for tuning in.